Knock, knock. I'm washing my hands. Do I have your permission to film this video today?
Sure.
How should I address you?
Kevin.
Hi, Kevin. I'm Laura. I'll be the nurse practitioner student performing your exam today. And today we're going to do an exam on your heart and lungs.
Okay.
Can you just tell me where we are right now?
We're in the dining room.
Okay. And what year is it?
2025.
Okay. And are you having any pain today? 0 to 10?
0.
Great. First, I'm going to begin your exam by just taking a look at your neck. I don't see any obvious pulsations, rashes, lesions, or abnormalities to the neck. I'm going to first feel your carotid arteries on the right and left side. Pulse is strong, even, and regular. Perfect. And I'm going to take a listen with the bell of my stethoscope to each side. While I listen, if you don't mind just holding your breath, you can take a breath in between each side. Perfect. I don't hear any bruise. And then I'm going to do an exam of your lungs. So if you don't mind just lifting your shirt for me. The thorax appears warm, dry, and intact. There's no rashes or lesions. Turgor is nice and brisk. I'm going to begin by listening to your lungs. I'll start in the back and then I'll come to the front. I'll be listening to the diaphragm of my stethoscope. And you can just breathe with your mouth slightly open. Breathe normal though, just take your time. We're going to do the same thing in the front to listen to your lungs. Great. Breath sounds are clear. I hear vesicular breath sounds over healthy lung tissue. No bronchi, wheezes, or crackles, or other adventitious breath sounds are heard. I'm going to examine your heart. If you don't mind lifting your shirt again for me, I'm going to first feel for your apical impulse, which is going to be on the left midclavicular line at the fifth intercostal space. Perfect, and I'm going to take a listen to your apical impulse at this spot for 1 full minute. Right. After 1 full minute, the pulse is even and regular with a rate of 62. And I'm going to listen to your full breath sounds with both the bell and the diaphragm of my stethoscope. You can just breathe normally through this. And I'm going to begin at the aortic area, which is at the left intercostal space of the right sternal border. And then to the pulmonic area on the left second intercostal space of the right sternal border, left sternal border. And then we have the second pulmonic. We have tricuspid. And the mitral or apical. Perfect. I'm going to do that same thing over again with the belt, the diaphragm of my stethoscope.
Okay.
Aortic. Pulmonic. Second pulmonic. Tricuspid area. And the mitral or apical. Heart sounds are even, regular. I don't hear any extra heart sounds, murmurs, or other sounds. And then I'm going to just feel for any aortic pulsations along your sternal and abdomen here. I don't feel any pulsations. And then I'm just going to examine your upper extremities. Skin is warm, dry, and intact. I don't see any obvious swelling. I'm going to check your radial pulses on each side. You have your right. Pulse is strong, even. Left. And I'm going to check your capillary refill for your perfusion. Capillary refill is nice and brisk. Perfect. I'm going to examine your lower extremities. Skin is warm, dry, intact. I don't see any obvious signs of edema. There's no pretibial edema present. I'm going to check your posterior tibial pulses on each side. Pulse is nice, even, and regular. I'm going to examine the other leg. Skin warm, dry, intact. No swelling. No pretibial edema on this side. Posterior tibial pulses present, even, regular. And then I'm going to check your dorsal pedis on each foot. Good, nice, even capillary refill through your lower extremities. And your toes is nice and brisk. And then one more side. Dorsal pedis pulses even and regular with brisk capillary refill in the toes. That concludes our exam today. Do you have any questions for me?
Nope, I don't think so.
Okay, great. Thank you so much.
Thanks.